Hello, dear listener. You're tuned into WellsRadio 89.3 FM, your preferred awesome radio. I'm reaching you live from Wells Broadcasting House along Alafia Avenue, Oluyole Estate, Ibadan. On that note, I want to welcome you to another episode of The Radio Doctor, where we dive into the world of medicine, health, and wellness. On this show, we explore medical facts, we debunk myths, and empower you with knowledge to live a healthier life. I'm your host, Dr. Tobilobajo, and together we will navigate the fascinating realms of healthcare right here on your favorite radio station, Wells Radio 89.3 FM. And of course, if you have any health concern you would like us to discuss, please feel free to reach out to us on wellsradiodoctor@gmail.com or via WhatsApp on 0915 4999 893. I take that again. You can reach us on wellsradiodoctor@gmail.com. You can send an email or you send a WhatsApp message on 0915 4999 893. And be rest assured that we will properly examine your thoughts and health concerns. And again, I welcome you to Radio Doctor. I'm Dr. Tobilobajo, also known as Daddy Ojo. Ẹ káàbọ̀ padà sí orí ètò yín ètò wa dókítà orí Radio Doctor. Nínú ètò yìí a máa sọ gbogbo nǹkan tó ń jẹ mọ́ ìlera ara, gbogbo nǹkan tó jẹ mọ́ ìlera tá ṣe lè wà ní ìlera ara. A ó sì máa sọ gbogbo ẹ̀ pé báyìí ló yẹ ká ṣe ṣe o, báyìí ló yẹ ká ṣe ṣe o tá fi máa wà ní ìlera ara. Tẹ́ dẹ̀ ní ìbéèrè kan tàbí òmíràn tẹ́ fẹ́ béèrè lọ́wọ́ wa, ẹ lè tẹ àtẹ̀ránṣẹ́ sí WhatsApp wa 0915 4999 893 àbí kẹ́ send wa ní email ní wellsradiodoctor@gmail.com. Gbogbo nǹkan tí ó dẹ̀ ń ròyìn lójú la máa sọ dáadáa, tá dẹ̀ máa sọ pé ọ̀nà báyìí ní kẹ́ gbà ọ́, ọ̀nà báyìí ní kẹ́ gbà ọ́ láti wà ní ìlera ara. We'll be discussing something so fascinating today, something so vital, something so important, something peculiar to our environment, something that once you look around you, if you are very observant, maybe while you were growing up, you notice some people they call special children, some people they call warriors, some people they call sickle cell warriors. And what are we discussing? We are discussing sickle cell disease. We'll be discussing sickle cell disease. Àwọn Yorùbá máa pè ní àrùn arọmọléegun, àbí àwọn tó máa ń pè ní láyé àtijọ́ tó máa sọ pé àbíkú kò ń ṣe bẹ́ẹ̀ náà ló ṣe rí, but a ó máa sọ gbogbo nǹkan tó jẹ mọ́ ìlera ara àwọn tó ní sickle cell àbí ìtàwọn èèyàn máa ń pè ní àrùn arọmọléegun. So what we'll be discussing is we'll be talking a lot about sickle cell disease. We'll help you debunk myths and also clarify information, things that can empower you. Maybe you have someone close to you with sickle cell disease. How should they manage themselves? During cold weather, during hot weather, what should they do? I know you might have heard it in diverse ways. You must have heard it in different ways that sickle cell, some people even believe it's a life sentence, but with advance in medicine, with advance in healthcare, people that are sickle cell disease live to old age, 80s, 90s, possible. So we should not see it as a life sentence, but we should see it as something we can actively prevent. Yes, we must work towards having a sickle cell free world. Yes, it is very possible. And we understand that sickle cell disease is hereditary, is a blood disorder that is characterized by abnormal hemoglobin. And this hemoglobin is the protein in red blood cells responsible for carrying oxygen throughout the body. And this condition affects millions of people worldwide. It affects Africans, people in the Middle East, people in the Mediterranean, people of Indian descent. And sickle cell disease can lead to various complications. The common one is the pain crisis, but it can also cause organ damage. It can reduce the lifespan of people. So it is getting to be something we must find a way to prevent. We should prevent it and find a way to have a sickle cell free world. However, advancement in medicine, advancement in healthcare has made it very possible for us to understand the concept of sickle cell and also to know how to treat. And by this treatment, by understanding all these concepts, we can significantly improve the outcomes for individuals living with sickle cell disease. So, as I said earlier, it is not a sure life sentence or a sure death sentence, but it's something that can be managed, it's something that can be prevented, it's something that can be effectively managed such that people living with this condition can live a healthier life. Nǹkan tí mo sọ ni pé àsán àrùn arọmọléegun ó jẹ́ nǹkan tí ó jẹ́ pé wọ́n ń bíyàn mọ́ ni, kò ń ṣe nǹkan tó jẹ́ pé irú ibà tó jẹ́ pé ẹ̀fọn jẹ̀yàn ni èèyàn fi rárá o. Tí bàbá àti ìyá bá jẹ́ àwọn tó ń gbé irú ẹ̀jẹ̀ sickle cell yìí, kò bá jẹ́ pé wọ́n kàn gbé ni àwọn ò jẹ́ sickle cell tó wà papọ̀ mọ́ ara wọn nínú ẹ̀jẹ̀ ọmọ tí wọ́n ń bí. For example, tí bàbá bá jẹ́ AS tí màmá jẹ́ AS, ó ṣeé ṣe 25% every pregnancy, 25% chance wà yìí pé wọ́n lè bí ọmọ tó máa ní SS tí wọ́n ń pè ní àrọmọléegun. Kò dẹ̀ ń ṣe àwa nìkan la máa ń ní, kò ń ṣe àwa táwa Nàìjíríà, káàkiri Africa, especially àwọn sub-Saharan Africa, ó ń ṣẹlẹ̀ ní Ghana náà. For example, ó ń ṣẹlẹ̀ ní Cameroon. Àwọn tó wà ní Middle East náà a máa ń rí ń bẹ̀, àwọn tó wà ní àwọn ọmọ India náà ó jẹ́ bẹ́ẹ̀. Bó a ti rí pé púpọ̀ lára àwọn tí kò ń ṣe aláwọ̀ dúdú wọ́n ti ń wá gbogbo ọ̀nà láti jẹ́ pé gbogbo àrùn arọmọléegun yóò di nǹkan gbàgbé pẹ̀lú nǹkan tí à ń pè ní genetic counseling. So kí wá ní ìdí tí àwọn èèyàn fi máa ń ní sickle cell? So we'll be talking about the causes of sickle cell disease, and we know that sickle cell disease is caused by mutation in the gene that instructs the body to produce hemoglobin, specifically the beta hemoglobin. And normally this gene provides instruction for making beta hemoglobin, and this is a crucial component of hemoglobin. And we know that individuals with sickle cell disease, this gene mutation leads to the abnormal production of hemoglobin, which is called the hemoglobin S. So usually the hemoglobin A is the normal hemoglobin we want everyone to carry. You say, I'm A, I don't fall sick, I don't do that. But once the person starts getting to be SS, the person is likely to fall ill regularly. And this is because hemoglobin S is kind of the configuration of the hemoglobin itself is rigid, and with some extreme conditions it becomes sickle shape. Sickle shape is like a crescent. On a normal day it's meant to be very flexible as it's passing through all the blood cells, all the areas of the body that oxygen nutrients are needed, all the areas where blood flows through. But in conditions like a low oxygen level or someone that is not dehydrated, it gets sticky and it gets sickle shaped, and this can stick to blood vessels, and when they start blocking some places, then pain will ensue. Then also some areas that are meant to receive adequate oxygenation, adequate nutrients, they get clogged, and in this form it can block the blood flow to that place, and that can lead to some forms of organ damages, even in the brain, even in the lungs, even the legs can have ulcers and all that. And all this will now become the complications that someone that has sickle cell disease will come down with. The person will be coming with a lot of pain and sometimes breathlessness if it affects the lungs and all that. And all this can even restrict the growth. That's why you see lots of children with sickle cell disease, they might not grow to the expected height. Some of them will have delayed puberty. Some of them will have they just keep falling ill. They don't exactly lead a healthy life that is free of frequent illnesses. And the inheritance of this pattern of sickle cell disease follow what we call an autosomal recessive pattern. Let me explain that to you. For example, we know that if someone carries hemoglobin A as well as hemoglobin S, the A, so far it is 50% of that blood in the person's system, we know that the person will lead a healthy life, though the person has a sickle cell trait. So we must define it and be very sure that AS is not sickle cell disease. AS is just a form of sickle cell trait. The person carries the trait as hemoglobin S at a part of the hemoglobin, but someone with SS, for example, will be the one to come down with the disease because there's no normal hemoglobin A in the system of that person, and that can lead to all those things I discussed with you earlier, talking about all the sickling, all the pains, all the organ failure, and so on and so forth. And this autosomal recessive pattern just means that it carries S. It needs another S for it to become a sickle cell disease. So if it is S and A, definitely that is not a sickle cell disease. So that's what I'm just saying about autosomal recessive pattern. It has to be 2 S's before it can become sickle cell disease. And this means that a child must inherit 2 copies of the mutated genes, one from each parent. So if it gets S from a parent, gets A from a parent, that is not hemoglobin SS. So that needs to be clear. And there's some variants that have a sickle cell. They have hemoglobin S and hemoglobin C. Hemoglobin C is also an abnormal hemoglobin. However, it's not as intense and not as bad as hemoglobin SS. So many people with hemoglobin SC might not have too frequent crises like the one with hemoglobin SS. Many people with hemoglobin SC can just have what we call retinopathy, proliferative retinopathy, and they might not really fall ill as people with hemoglobin SS. And of course, they too, they have their own peculiarities. They have to be treated as people that are carrying 2 abnormal hemoglobins, and also there are so many specifications that are given to them in health facilities to ensure that they don't expose themselves to extreme conditions that can lead to coming down with infections and any form of infirmity. So for someone to be called hemoglobin SS, that means the person got hemoglobin S from the parent, that's from both the father and the mother, or even in some cases of in vitro fertilization, that is the donor sperm carries hemoglobin S and the donor egg or the recipient egg also carries hemoglobin S, and this is what we now call sickle cell disease. So nǹkan tí mo sọ ni pé kéèyàn tó ní àìsàn àrọ̀mọléegun, ó máa nídìí kó jẹ́ pé irú ẹ̀jẹ̀ tó gbà ní ara bàbá ó jẹ́ hemoglobin S, irú ẹ̀gbà ní ara ìyá náà ó jẹ́ hemoglobin S, ìyẹn ló wá papọ̀ tó fi ń di hemoglobin SS. A dẹ̀ ti rí pé kí ni ìdí tí àìsàn àrọ̀mọléegun yìí gan fi máa ń jẹ́ kí gbogbo ara máa ro ọmọdé àbí kó máa ro àgbàlagbà, àbí àwọn tó ní àìsàn àrọ̀mọléegun yìí kí ló máa ń fà á? Rí pé tí wọ́n ti ṣe bí pé tí wọ́n ti ṣe wàhálà, àbí tó wá jẹ́ pé ibi tí wọ́n wà ó ti tutù jù, ó ti gbóná jù, àbí wọn ò mómi dáadáa, àbí stress, ẹ̀jẹ̀ wọn tá à ń pè ní hemoglobin tó jẹ́ hemoglobin S yẹn, instead of tó fi máa lọ káàkiri gbogbo ṣan kó máa rí wípé bí tómi ṣe máa ń wá ọ̀nà àti gbà fún rẹ̀, á di pé ó máa lẹ̀ mọ́ ara àwọn iṣan yẹn. Tó wá dẹ̀ ti lẹ̀lẹ̀lẹ̀, ó lè jẹ́ pé ó lè dí ibi tí ẹ̀jẹ̀ yẹ kó máa lọ, ó lè díbẹ̀ pa débi pé ẹ̀jẹ̀ ò ní ráyè débẹ̀ mọ́. A dẹ̀ rí pé gbogbo nǹkan tó jẹ mọ́ èròjà tí ẹ̀jẹ̀ ń gbé káàkiri àti afẹ́fẹ́ oxygen tó yẹ kó gbé débẹ̀ kò ní gbé débẹ̀. Ó dẹ̀ ṣeéṣe pé gbogbo ibi tó yẹ kó máa supply yẹn, gbogbo ibi tí ẹ̀jẹ̀ yẹ kó máa dé yẹn ó máa bẹ̀rẹ̀ sí kú. Ìyẹn là ń pè ní like ischemia. Ó máa bẹ̀rẹ̀ sí débẹ̀. A dẹ̀ di pé tó wá jẹ́ pé inú fùkùfùkù tá ń pè ní lungs nísìn tó wá ti díbẹ̀ pa, á di pé ó máa ṣòro fún ọmọ bẹ́ẹ̀ láti mí. So gbogbo kinní yìí la gbọ́dọ̀ wé pé àìsàn àìrọmọléegun yìí ṣé nǹkan tó ń fa ní stress ni. Táwa ti rí pé ọmọ yìí ó ti ń stress ara ẹ̀ jù, ó yá lọ jókòó bẹ́ẹ̀ yẹn, àbí tátẹ́gùn wa ti pọ̀ jù, torú wa ti pọ̀ jù, àbí ọmọ tí ò mọmi dáadáa, a rí pé gbogbo kinní ló máa ń tì wọ́n sí nǹkan tá à ń pè ní crisis. So a ó máa sọ̀rọ̀ nípa tá a ṣe ń dènà àìsàn àrọmọléegun yìí. So what I'm saying is that we'll now be talking about how to prevent this sickle cell disease, because prevention, as they say, is better and cheaper than cure. So for preventing sickle cell disease, primarily what is usually important is what we call genetic counseling and testing carriers of gene mutation. So couples with a family history of sickle cell disease or those belonging to high-risk ethnic group may choose to undergo what we call genetic testing before starting family. It is very important. Before any young couple gets married, they must know their genotype. They must know their genotype. Another thing they must know is their resource factor. We'll still talk about resource incompatibility in one of the episodes, and it will be also an enlightening session. So you must know your genotype. One thing we get from so many people in the hospital is that once you ask the man, oh, what's your genotype, he assumes it's AA and he just mutters it AA, and the spouse to be too will say, my better half is AA. What is the evidence that is AA? Without a blood test that is done and clarified, you can't just claim to be an AA just because you don't fall sick. You might be AS that doesn't fall sick, and the other person might be AS too that doesn't fall sick, and definitely there's a 25% chance, or even higher in some cases, of having SS child from AS and AS. And don't wait to be permutating or to be saying that we can give that to AA now, let's try. The pain of having one SS child, the cost implication for you, the stress on the child, the morbidity that comes with that can be so intense. In fact, it can wipe the so-called love away. So prenatal genetic counseling is the first thing. Then the second thing we move to is what we call prenatal screening and diagnostic technique. Before, they used to do what we call chorionic villus sampling amniocentesis, but now we know that there are some advanced tests that are done on women, that you don't have to stick needle into their womb to be taking samples from the baby, to be taking samples from the fluid. There are some blood tests now that are done with a lot of sophisticated machines, high performance chromatography. They do all the genetic sequencing, and they can know even from the maternal blood if a child in the womb is a sickle cell disease. And this information will allow parents to make informed decisions about their pregnancy and plan for appropriate medical care if the child is diagnosed to be sickle cell disease. It's a whole ball game we deal with in the medical world when we now know that, this child someone is carrying is a sickle cell disease, and it's not just what we push to the back, it's something we effectively counsel the intending parents on, and then we allow them to make an informed decision. And in recent years, advances in reproductive technology such as pre-implantation of genetic diagnosis and in vitro fertilization has provided additional option for couples at risk of passing sickle cell to their disease to their children. And these techniques involve screening embryos created through in vitro fertilization, which we call IVF, for the presence of sickle cell disease mutation before implantation into the uterus. So what that typically just means is that in some cases of what we call assisted reproductive techniques, we can actually say that this embryo, before we put it into the womb of the woman, is a sickle cell carrying embryo, and then we make a decision from there. So even before the baby starts developing in the womb, there are advanced technology to detect if a child that is just being formed at that point of conception is a sickle cell disease patient, and then we make decisions. So nǹkan tí mo sọ ni pé oríṣiríṣi ọ̀nà là ń gbà láti dènà àìsàn aromọléegun. Ìta kọ́kọ́ máa ń bẹ̀rẹ̀ ni pé kí ọkọ àti ìyàwó kán mọ irú ẹ̀jẹ̀ tá à ń pè ní genotype wọn. Èyí ṣe kókó ó sì ṣe pàtàkì nítorí pé AS, SC, gbogbo nǹkan bẹ́ẹ̀ yẹn tí wọ́n wá fẹ́ ara wọn, ó ṣeé ṣe kán bí ọmọ tó ní àìsàn aromọléegun tá à ń pè ní SS. A dẹ̀ mọ̀ pé àti ìbẹ̀rẹ̀ mo fẹ́ bẹ́ẹ̀ ni o. A mọ̀ pé tó wá di pé a ti ń bí ọmọ SS, ìfẹ́ yẹn ó máa lékè nǹkan díẹ̀ nítorí pé gbogbo ìtọ́jú tó máa gbà, gbogbo ẹ gbọ́dọ̀ ṣe lé, ẹ gbọ́dọ̀ ṣe lé, ẹ gbọ́dọ̀ ṣe lé, àti gbogbo ipa tó máa ní ara ọmọ tí wọ́n ń bí yẹn, ipa yẹn máa ń pọ̀ gan-an. So kò ń ṣe nǹkan tí èèyàn kàn fọwọ́ rọ́ sẹ́gbẹ̀ẹ́ pé èyí jẹ́ èyí ò jẹ́ pé 25% àkókò lè bí ọmọ AA, kò rí bẹ́ẹ̀ nítorí pé tí èèyàn mọ SS gbogbo wàhálà yẹn ó máa ń pọ̀ fún ọmọ, ó máa ń pọ̀ fún ìyá, ó dẹ̀ máa ń pọ̀ fún gbogbo wa ní agbègbè, because kò ń ṣe nǹkan téèyàn kàn lè fọwọ́ rọ́ sẹ́gbẹ̀ẹ́. Nǹkan tó jẹ́ pé is between life and death ni sickle cell máa ń jẹ́, especially pẹ̀lú ọmọ tó wá ní crisis. So àtúmọ̀ pé ọmọ tó wà nínú oyún náà wọ́n lè ṣe test fún pé ó ní àwọn tẹ́lẹ̀tẹ́lẹ̀ wọ́n tiẹ̀ máa ń ṣe pé wọ́n máa gbé bí abẹ́rẹ́ kan, wọ́n á fi fa omi tí ó wà nínú ilé ọmọ, bọ̀ wọ́n kì í fẹ́ ṣe irú ẹ̀ mọ́. Ìsìn nǹkan tí wọ́n tún ṣe nísìn ni pé wọ́n á fa ẹ̀jẹ̀ ìyá tó ń gbé ọmọ, wọ́n á test ẹ̀ pẹ̀lú àwọn oríṣiríṣi equipment, oríṣiríṣi àwọn irinṣẹ́, wọ́n á wò ó dáadáa, wọ́n á ṣe genetic sequencing gbogbo ẹ̀ ṣá, wọ́n á wò dáadáa pé ṣé ọmọ tí ìyá yẹn ń gbé ṣé sickle cell ni. A dẹ̀ tún rí pé pẹ̀lú gbogbo àwọn ọmọ tí wọ́n máa ń pè ní IVF, àwọn ọmọ tó jẹ́ pé àwa onímọ̀ ìṣègùn òyìnbó máa ń wò pé ó ṣòro fún bàbá àti ìyá láti bímọ, wọ́n á máa ṣe nínú lábí pé wọ́n á yọ sperm, wọ́n á mix ẹ̀ pẹ̀lú kíní, wọ́n á wò pé báwo làwọn ṣe lè gbé sínú inú ìyá láti jẹ́ pé ọmọ yẹn máa bẹ̀rẹ̀ sí develop tá à ń pè ní IVF. A rí pé kán tó gbé ọmọ yìí sínú ilé ọmọ, wọ́n tún máa ń wò pé ṣé ọmọ yìí ṣó ní sickle cell. So sickle cell is best prevented because of the impact of morbidity and mortality. So I'll be leaving you to take in all this message I've shared earlier, and then I'll come back from the musical break to enlighten you more on holistic management of sickle cell disease. Don't touch that dial. Welcome back to your favorite show, Radio Doctor, and earlier we've discussed all what we need to know about understanding the causes and also how to prevent sickle cell disease. Ẹ káàbọ̀ padà sí orí ètò yín, ètò wa dókítà orí rédíò, tá ti sọ̀rọ̀ nípa gbogbo nǹkan tó ń fa àìsàn aromọléegun àti ọ̀nà tá a lè gbà láti dènà ẹ̀. So I'll be building on what we've discussed earlier by enlightening us on the holistic management of sickle cell disease. This is very vital because once it has happened, it has happened, and the best way is to have a holistic approach to manage sickle cell disease. Yes, it is very manageable, and people with sickle cell disease can live a very comfortable life, can live a very meaningful life. There's so many sickle cell disease patients that are doing well as authors, as doctors. So many people that are with sickle cell disease that are doing well as broadcasters, as content creators, as just name any field. And even there's a bias that it's not actually biased. I've actually found it to be true that so many sickle cell disease are very brilliant. Yes, I've found that out. I don't know if it has been established in many studies, but it is well known while I was growing up that definitely many people that are sickle cell disease are actually gifted with a lot of intellectual prowess. And I don't know if you've also noticed that in your environment or while growing up. So for the holistic management, we know that currently there's no cure. Yes, there's no cure. However, there are some management techniques that gives us an holistic approach and also address diverse needs. And also there are some new frontiers. For example, the use of stem cells, the use of bone marrow transplant to find a way to knock off the old type of blood producing cell and definitely produce newer ones. So there are so many new frontiers that are coming up these days. And of course, as I said earlier, cold is one of the causes of sickle cell disease. So usually we tell them to to be in an area of optimum temperature, should be in an area that is not too cold, not too hot. Then they should drink a lot of water and to find a way to prevent dehydration. Then, for example, if there's a stressor that finds a way to stress them a lot, maybe there's a lot of emotional turmoil in the environment, there's a lot of intense stress, they should find a way to avoid that and optimally manage their health very well. Then also, we also know that there are some medications that we call daily medications that are prophylaxis against crisis. For example, in this environment, they take a lot of anti-malaria prophylaxis. Then also they take some blood supplements, because we know that with this sickling, a lot of sickness can come. Because one of the things that happen in a case of sickle cell is that there's an area in our body called the spleen. The spleen is like a lymphoid tissue. It's kind of a tissue that helps to prevent and fight infection. Yes, so there are blood vessels that get into that place, and one thing is that once they get clogged up, they get to block all those places. There's what we call fibrosis. There will be death in that spleen, and in this case, as there's death in the cells of the spleen, it predisposes the sickle cell patient to a lot of infection, because the spleen will be helping to prevent infection. And these are the things that we must have in mind when we are managing people with sickle cell disease, that as much as we want them to lead a good, healthy life and all that, we must also actively work towards prevention of infection. So a sickle cell patient as a child is not the one playing in the rain, is not the one having a lot of cuts in the body unattended to, is not the kind of child you expose to extremes of temperature. You help to manage the health of that child. So as much as possible, you find a way to prevent infection. Then also you must also create a loving environment for the child, because there's a lot of emotions that are attached to having a sickle cell disease. It's not the child you just say that you just talk down on that kind of a child. No, it's a child you nurture with love. It's a child you help to understand the condition of his or her health, and you can find a way to implement a lot of strategies to make life comfortable, as well as the child should thrive in that environment. Because as I said earlier, I have found out that most of them end up being brilliant. So you create an atmosphere of love where they can learn and they can be the best version of themselves, because being a warrior doesn't mean that you can't achieve the maximum of your dreams. You can't achieve a lot of things you envisage for. It's just a condition that you can find a way to lead a healthy life and live a meaningful life. And also, there are new frontiers now. For example, the development of bone marrow transplantation, and that is a kind of management where the old cells of because it's the bone marrows that are producing the red blood cells that get sickled, right? So what this technique does is that it harvests bone marrow stem cells from relatives, maybe relatives that are compatible, and then they implant it in the bone marrow of the child with sickle cell disease and knock off all the old red blood cells that are coming out, and in that way the new ones that will be produced will not be hemoglobin S. And this is a new development, and also this is the development that has been perfected over and over. It has been tested and it has proven to work. However, it's not every case that it gets to work. That is, there can be bone marrow transplant failure. As there are organ transplant failure, there's also the possibility of bone marrow transplant failure. However, it is done in the best of conditions. It is expensive. I must also mention it's still an expensive technique because it is not well popularized everywhere globally. There are some selected centers where they are done, and definitely if there's a success rate, you can know that the person will not be hemoglobin SS anymore. So nǹkan tí mò ń sọ ni pé oríṣiríṣi ọ̀nà là ń gbà láti tọ́jú àìsàn arọmọléegun. A máa wò pé prevention náà òun ni nǹkan tá máa káti ẹ̀ kọ́kọ́ dènà ẹ̀ náà. Gbogbo nǹkan tá dẹ̀ ti sọ lẹ́yìn ìbẹ̀rẹ̀ láti sọ. Then gbogbo nǹkan tó ń jẹ mọ́ infection, gbogbo nǹkan tó ń jẹ mọ́ ọmọ ń ṣeré nínú òjò ni, ọmọ òun mú mi dáadáa ni, gbogbo ẹ̀ la gbọ́dọ̀ dènà fún. Àbí ooru tí ń mú jù bí kan ni, ẹ̀fọn tí ń pọ̀ jù bí kan ni, gbogbo ẹ̀ la gbọ́dọ̀ dènà. Nítorí pé àwọn ọmọ sickle cell ó ní nǹkan tá à ń pè ní spleen tó wà nínú wọn, tó jẹ́ pé pẹ̀lú gbogbo ẹ̀jẹ̀ tó ṣe ń blọ́ọ̀kì spleen yìí, ó ṣeé ṣe kó jẹ́ pé iṣẹ́ tó yẹ kó máa ṣe láti dènà àìsàn kò ní lè ṣe dáadáa, nítorí pé ara àwọn èròjà àti cell tó yẹ kó fi ṣe yẹn ó máa bẹ̀rẹ̀ sí kú. So gbogbo nǹkan tó jẹ mọ́ infection a gbọ́dọ̀ dènà ẹ̀. Gbogbo nǹkan tó jẹ mọ́ kò mú mi dáadáa a gbọ́dọ̀ dènà ẹ̀. A dẹ̀ rí pé àwọn nǹkan tí ń wà sí tí wọ́n ti ń ṣe tó jẹ́ pé irú operation tó jẹ́ special operation tó jẹ́ pé inú egungun wọn ti máa ń ṣe, tó jẹ́ pé ọmọ tó jẹ́ sickle cell disease wọ́n á ṣe irú operation yìí fún gbogbo nǹkan tó jẹ́ inú egungun ẹ̀ á jẹ́ pé ẹ̀jẹ̀ tó wá máa produce wọ́n á gbà láàrin bóyá family ẹ̀ kan ni o, ẹ̀jẹ̀ tó wá máa produce later kò ní jẹ́ ẹ̀jẹ̀ SS mọ́. A dẹ̀ mọ̀ pé gbogbo nǹkan tó jẹ́ mọ́ oògùn tó ń lò lójoojúmọ́ wọ́n gbọ́dọ̀ máa lò ó. Gbogbo oògùn tó ń dènà ibà, gbogbo oògùn tó ń dènà àìsàn, gbogbo oògùn tó jẹ́ pé kò ní jẹ́ kí ẹ̀jẹ̀ wọn máa lọlẹ̀, wọ́n gbọ́dọ̀ máa lò ní lóòrèkóòrè. Àìsàn arọmọléegun yìí ó dẹ̀ jẹ́ pé tó wá ti ṣẹlẹ̀ tán, ó ní àwọn ìtọ́jú tá tún máa ń fún wọn. For example, a máa fún wọn ní àwọn oògùn ara ríro kan. Tó wá jẹ́ infection, a máa fún wọn ní oògùn tó máa tọ́jú infection yẹn. Tó wá jẹ́ pé wọ́n ní egbò lẹ́sẹ̀ ni, a máa ṣe ìtọ́jú egbò yẹn dáadáa. Tó wá jẹ́ pé wọn lè mí dáadáa, ó máa di pé wọ́n fún wọn lọ́xygen. Tó bá jẹ́ pé ẹ̀jẹ̀ wọn ó ti ń lọ sílẹ̀, á jẹ́ pé wọ́n máa gba ẹ̀jẹ̀. Ṣé rí pé gbogbo ìtọ́jú wọ́n ń tọ́jú gbogbo nǹkan tó ń ṣẹlẹ̀ lọ́wọ́lọ́wọ́ báyìí, because tá a ṣe sọ tẹ́lẹ̀ kò tí ì secure, but gbogbo nǹkan tó ń jẹ mọ́ bone marrow transplant ó ti ń fún wa ní hope pé cure ti ń wà díẹ̀díẹ̀, but prevention, dídènà ẹ̀ gangan òun lòdù, òun gangan ni nǹkan tó yẹ ká mú ní ọ̀kúnkúndùn. What I'm trying to say is that when we are trying to manage people that have come down with sickle cell crisis, we do a lot of management with painkillers, we hydrate them, we give them antibiotics and also other antimicrobials, and also the ones that have malaria, we treat the malaria, and the ones that the blood level is too low, we end up transfusing. So we can see that we even give some of them hydroxyurea, different types of drugs that are used to manage sickle cell disease. As at now, there's no definitive cure. However, the bone marrow transplantation that is in place now is giving us a lot of hopes, and there are lots of success stories. But prevention, as we always say, is better than cure. So we must understand in this show that sickle cell disease is highly preventable. And we've already mentioned the genetic counseling, the premarital counseling, the preconception counseling, and all that as the primary means of preventing sickle cell disease. So I won't leave you without telling you some things about warriors. When we say warriors, we are talking about sickle cell patients. We are talking about people that are living with sickle cell, and people that are living with sickle cell are not weak. People that are living with sickle cell are not spirits. People that are living with sickle cell are not abnormal. They are as humans as you are, and they are even warriors in the sense that the pain they go through is what many people can't go through. The pain they go through and still thrive, the pain they go through and still make meaning out of life is worth celebration. So we should let a world that is sickle cell free, we should make it possible with all these things we've spoken about. So I'm saluting all sickle cell warriors now, and I want to say we love you, we celebrate you, and you're doing well. So big shout out to my studio engineer Osas and Steve for making this show possible today, and big shout out to everyone that has been listening to Radio Doctor all the way from the first episode to the 7th episode we are in right now. I want to say I celebrate you all. Thank you all for your feedbacks, and definitely if you still have questions or conditions you would like us to discuss, you can send it to wellsradiodoctor@gmail.com, or you send us a WhatsApp message on 091 54 999 893. I take that again, 091 54 999 893, or feel free to send us messages on our Facebook page, on our Instagram page, on our X page at WellsRadio 893, and definitely on this show we'll still be taking our time to debunk myths. We'll still be taking our time to enlighten you, empower you with information, health information that is quality, health information that will impact your life. So keep it logged at Wells Radio 89.3 FM, and definitely we love you and we celebrate you all. Thank you for listening.